Welcome back. It's Dr. Jen Verboni, doctor of physical therapy, better known as DocJenFit, owner and founder of Gen Health, your platform for all things aches and pains or just wanting to feel good within your body and have a daily plan to follow. Now, today, I want to go over stability work that you can do if you're having low back pain during pregnancy. Now, I have done an amazing mobility flow for low back pain, and you can check out that video, but this one is going to be more of that stability and strengthening work. We have to remember, because during pregnancy, especially as we get later into pregnancy, we have this relaxin hormone that helps everything relax and open. So we're already opening so much within our body. And I know a lot of times our first instinct when we think of a pain is to stretch it. But actually, especially during pregnancy, we want to stabilize. We want to help to strengthen and support our body. And this is not only going to help to support your body now during pregnancy, but also during postpartum. So I'm going to run you through some exercises and kind of just a little exercise flow that you can always come back to, or you can use these individually and kind of sprinkle them in throughout your workout plan. Now, I'm also going to take you through at the end just what I've been doing for my body to help maintain the stability and mobility and help me feel so good without having to think. So I'll tell you the exact plan that I've been following, but I'll save that for the end. So we're going to start here with a chair bridge. Now, it doesn't have to be exactly like this, but a chair, a lower surface, a bench, and we're going to come and lie down on your back. Okay. Now, remember, for exercises, just like you're getting checked at the OB, you can always be on your back for a short period of time, as long as you're not spending a whole night onto your back. Okay. But you also listen to your symptoms. If you start to feel dizzy or uncomfortable, always come out of it. Okay. So we're going to grab a small pillow, or like a Pilates ball that you can squeeze between your legs, just to help increase that strength and stability of the inner thighs that connects into that pubic bone. Okay. And then while we're doing this, so we're also going to work on hamstrings, because I'm going to press my heels down into that elevated surface, and just pushing your heels down, you should already feel like your pelvis kind of lifts. Those are your hamstrings. Okay. So those are your hamstrings working without even having to go very high. So we're going to combine that. We're going to squeeze and we're going to press. Okay. Now, as I take deep exhales, and that's as high as you're going, you're not going into a full bridge here, thinking of lifting your booty up. We're going to just think of pushing those heels down, squeezing into that pillow, and then doing deep exhales, wrapping into that core. So I'm going to hold here, press down, pull in, do a deep breath in, breath out. 5 times. Hug and wrap into the baby. Keep pushing down, pull down, 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 pull in together. And then come out. Now, you could do that 3 times, but just doing it once, you should already feel you're starting to work in the back of the legs and in the inner thighs. And how great is that? Now, we're going to flip it over to a hip thrust position. Now, I love this instead of just doing a bridge on the floor, especially as the belly starts to grow. It can be really uncomfortable to do bridges on the floor. So I'm going to prop my shoulder blades up. So you want your shoulder blades to be propped. And I'm going to think of lifting up and tucking my tailbone under. So as I come up and push my feet down, so it's more of a push down, I'm going to think of tucking under and exhaling in wrapping my baby. So exhale, come up, and slowly come down. Exhale, wrap, tuck under, and slowly down. Slowly down. We're going to do 5 together. Tuck, wrap. And this time we're going as high as you can, but in a controlled manner, tucking under. And if you feel any low back pain, that is an indicator we're going too high and we're not tucking under and wrapping into that belly. So tuck under and wrap. Okay, so it should be pushing straight down. You also want to make sure if your feet are too far and you're feeling a lot of hamstrings and you're not really feeling glutes, then you want to walk your feet in a little bit more. If you're feeling too much on the front of the legs, your feet might be a little too close. So you kind of have to find that Goldilocks spot. It's not too far, not too close. It's right underneath your knees so that you feel a lot of that glute power kind of working here, creating that stability in the back of the pelvis. Okay. Now we're going to do 3 more in standing. So now I want to grab a stable step stool, and it doesn't have to be, very high. And we're going to continue on working those glutes. So we work the glutes kind of in the end range position. Now we want to work them slow on the way down. And this is where you really start to build that strength. And we want to maintain that good stability through that pelvis. So I'm going to use the wall here for support. You can use a counter. You can use something stable. Just you want to use support or even like a doorway holding on in front of you. We're not trying to do a balance exercise here. Okay. And what we're going to do is you're going to think of this leg kind of hanging back. So it's not reaching. We're reaching more from the hip. So maybe I'll show you on the other side first. So we want this hip to think of reaching straight back. The knee is going to stay directly pretty much over the ankle. Okay. So my hip is going to come back as far as I can tolerate, nice and slow, and then press back up. So it's slow and controlled. Slow, push down in that foot to come up. Okay, slow on the way back. Slow, push down and come back. And that heel never raises. Okay, let's try 5 together. Slow, because even just with 5, you should feel it. Press down. Slow, that hip is back, and then push. And you should already start to feel so much engagement. Quad is going to be working because your knee is bending, but we really want to get that hip back. Okay. So we'll try 5 on the other side. So again, hip back. And if you do about like 8 to 10 of these on each side, or until you feel like, I can't, I'm going not as low, or I'm really fatiguing out. Like that's a good indicator that you're going to kind of like your max for your muscle, pressing down on the way up, kind of coming up faster. Push that hip back. And sometimes I like actually having that verbal feedback. So hand on the hip, guide it back. Okay. And that chest just kind of follows. That hip goes back, and then push down. Hip goes back, and I'm not pushing off my back leg at all. So even if it touches, I'm pressing down. Okay, so that's key. I'm not pushing off of that back leg. I'm really using that support to kind of support my body, but I'm using my leg to really activate those glutes. That's key here. Okay, so that's a good way to get that back end of the pelvis, but we don't want to forget about the front of the pelvis. And this is where a lot of people sometimes end up forgetting. So I'm using a therapy loop. Now, a resistance loop. We actually have a whole therapy kit, and it comes with a free low back plan where you can understand how to utilize all that's involved with it. And that's completely free. So if you don't have these loop bands for home or longer bands at home, I would highly recommend that kit. And we'll have it linked up and a little discount code as well. So I'm going to place this in my feet here. And again, I could use the wall or something stable for support. And I want to just think of exhaling and drawing my knee up as quickly as possible. Slow on the way down. And again, up. Slow. This is where I really start to work that front of the muscle. Breathe out, because that's going to help to use my abdominals with that hip flexor. Slow. What I often find, yes, we want to stretch those hips. Yes, we want to feel that release, but we don't want to be weak. And a lot of us are weak in those hip flexors because we don't utilize them. So getting strong hip flexors is so crucial. Breathe out. Slowly come down. Last one. Breathe out. Slowly come down. And let's try 5 on the other side. Again, you can do about 8 to 10 on each side. You can do about 3 rounds for all of these. Breathe out. nice and slow on the way down. And if using a resistance band right now, especially as you're pregnant and you're feeling a lot of things, is too much for you, don't use a resistance band. Just use your own body weight. That's fine. Coming up nice and slow. And what you'll notice, I'm using a yellow resistance band, which means that it is pretty light. Okay. I'm not trying to go the heaviest here. I'm really just trying to work within what my body has available to create that strength and stability and make sure that I'm just doing it with a good controlled manner. And what you also notice is you get some single leg stability work with that glute on the opposite side because it's helping to stabilize you, which is so great. Okay, last thing that we're going to do for that stability around that whole pelvis to help support that low back is some different core. So I'm going to actually sit on a therapy ball here, or a Swiss ball, or a physio ball, whatever you may call it. This is a great tool to have during pregnancy anyways, so might as well utilize it. And I'm going to have a seat here. Make sure I have these out of my way. And this is how I want you to start thinking of this core now, rather than sit-ups. It's really stability. Now, what this Swiss ball, stability ball kind of gives you is it doesn't give you as much stability. So now I have to use my core to kind of work and combat that. So I'm going to exhale and lift my knee and control it down. Exhale, and as I exhale, I want to think of hugging my baby in. So I'm pulling slightly from my pelvic floor up, and I'm hugging my baby in on the exhale. Try not to move too much. Slowly down. Slowly down. So we just worked hip flexors. Now we're working a little bit more on that core stability, side to side, getting you stabilized. And if you do 10 marches on each side, 2 to 3 rounds of this, you're going to start to work and utilize that core. We still want to work the core just in a way that doesn't put as much pressure down the midline of that abdominal muscle, because we already have so much stretching of that tissue happening, right? So if we utilize more of our transverse abdominis, our pelvic floor, our obliques to kind of help and stabilize us, we can start to activate and work the core in a much more balanced manner, and it's going to be supportive. Our core works with us as we're going through labor and delivery, just in a different way. So bearing down, pressing out, we want that core to help and utilize that strength. So getting strong, maintaining strength in the core is so important. And this is how I modify a lot of core exercises. Now, we do have a full body low impact plan on Gen Health. And this is the plan that I follow both of my pregnancies. And you can start a week free and explore it and see what it feels like within your body. But I would highly recommend use code OPTIMAL because you get a little discount as you come into it. And what the full body low impact gives you, not only core that you can, I just showed you how you can modify, but you get core, mobility, strength workouts that only take 30 minutes, because especially now as I'm already a mom and coming into a mom life, I don't have a lot of time to work out, and I have to do something that could be accessible from anywhere. So these workouts really could be accessible from anywhere, and they give you these muscle activations. So not only are we working all the different aspects that we did, but you're going to have a plan to follow and 3 phases so that you can continue progressing all throughout your pregnancy. I highly, highly, highly recommend this plan. It's helped so many mamas alike and people who are not pregnant or in your postpartum journey. So I'd highly recommend checking this out. It is the full body low impact plan on Gen Health, and you can use code OPTIMAL and get that extra discount.
Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.